frequent procedure is a rejuvenation surgery which comes from an analysis of the aging process physiology. The muscular contraction has been a subject of interest for a long time. The contraction of the orbicular muscle is manifested by a spiral clockwise on the right side and inverse on the other side, with subsequent signs dropping of the lateral part of the eyebrows, V deformity. The separation of the palpebral and orbital part explain the medial hollow. The inter-eyebrow space is subject to important variations depending on the individual. The contraction of the elevator nasal alar drops the nose. The contraction of the platysma explain the deformity of the neck with the cords, and the contraction of the depressor angularis drop the corner of the mouth. We can therefore distinguish four zones: inter-eyebrow, palpebrofrontojugal, cervical and nosolabiomental. Endoscopy allows us to treat rejuvenation requests. The endoscopy procedure involves the 2/3 superior part of the face. The frontal approach is subperiosteal. The opening of the periosteum allows a direct view on the muscle procerus, corrugator, depressor supercilium orbicularis. We dissect behind this one with an endoscopy view for the supraorbital and trochlear nerve. The junction between the temporal plane and the periosteum is always performed from the outside to the inside to avoid any damage to the temporal aponeurosa sheets which could modify the level of dissection. The lateral approach shows the temporal vein called sentinel. This one is dotted, opening the pathway to the malar and jugal area. We go on zygomate muscles subcutaneous. After have seen the suborbicularis orbitari fadpad and the malozygomatic sensitive nerve. After the section of the muscle, we can fix the elevation of the forehead with endotine system of Copt, a coat rack system locked in a bony hole. The malojugal zone is fixed with a hanger system as aptos, cog thread. The tail of the eyebrow is too suspended. The cervical party is beginning with an extensive infiltration of the subcutaneous fat, and we proceed to liposuction. A submental incision located 1 cm posterior the submental fold. We remove the subplatysmal fat and cut the cervical platymal cords. We realize a PR tragal and PR capillaries incisions after a subcutaneous dissection. We remove the fat of the PR parotidian space and the excess can generate by the fixation of the platysma muscle. We finish with the section of the depressor angularis and the elevator olicnosi,